What should I ask about my skin pathology report? When you get a skin pathology report, especially after a biopsy for a suspicious lesion or skin cancer, it can feel overwhelming. Knowing what to ask your doctor helps you understand your diagnosis and your next steps. First, ask what the diagnosis is. Find out if the tissue is benign, meaning non-cancerous, or malignant, which means cancerous. If it is cancer, ask what specific type it is, like melanoma, basal cell carcinoma, or squamous cell carcinoma. Knowing the exact diagnosis is key to understanding your treatment options. Next, ask about the characteristics of the lesion. Request details on features such as tumor thickness, often called Breslow thickness, which measures how deep the cancer has penetrated the skin. Thinner tumors generally have a better outlook. Also ask if there is ulceration, meaning whether the skin surface over the tumor is broken, which can suggest a more aggressive cancer. Inquire about the mitotic rate, which shows how quickly the cancer cells are dividing and growing. Ask about the Clark level, which describes how deep the tumor has invaded into skin layers, although it is less used now than Breslow thickness. It is also important to ask if the surgical margins are clear, meaning no cancer cells are at the edges of the removed tissue, as this might mean further surgery is needed. Clarify whether the lesion is primary, meaning it started there, or if it is metastatic, which means it has spread from another part of the body. This affects your treatment plan. Ask how the features observed in the report translate into the stage of the cancer. Staging helps determine prognosis and treatment options. Find out if there are signs that the cancer has spread to lymphatic or blood vessels, which can increase the risk of metastasis. Also, ask if the report notes any other findings, like inflammation, regression, or satellite lesions, which are small tumor deposits near the main lesion. Your doctor can tell you what these mean for your health. It is also essential to ask about the next steps. Based on your report, does your doctor recommend additional surgery, a sentinel lymph node biopsy, imaging tests, or other treatments? Understanding what comes next is important for planning your care. Ask how these results impact your prognosis and follow-up care. Knowing your risk of recurrence and what kind of surveillance you need helps you stay proactive. Lastly, request a copy of your pathology report. Having your own copy allows you to review the details and seek a second opinion if needed. Remember, always discuss your specific report with your dermatologist or healthcare provider to get personalized advice. Understanding these key questions empowers you to participate actively in your skin health and ensures you are well informed about your diagnosis and treatment options.